Since the novel coronavirus pandemic, we are more aware of how viruses spread through interpersonal contact. To try and keep the virus at bay, you may practice social distancing, wear a mask, and thoroughly wash your hands. But what happens when someone with the virus naturally expels it from their body through human waste? Researchers at the Southern Nevada Water Authority are among a small group of people across the country who are studying the presence of the virus genetic material in untreated wastewater.
So early on in the pandemic, it was found that the viral genetic material is found in the feces of infected individuals, and that creates a direct link to wastewater. And then especially here in Southern Nevada, with the Las Vegas wash going back into Lake Mead, there's that potential link there. So as the Water Authority, we were interested in learning what the potential connection was, and we wanted to provide some information to the water industry in general so that we could reduce some of the uncertainty related to this.
While the SNWA has found the genetic markers of the COVID-19 disease in raw sewage, it is not found it in wastewater after it's been treated. Nor has it been found in the Las Vegas wash, which carries treated wastewater and surface water runoff to Lake Mead. The virus has not been found in Lake Mead, nor has it been detected in treated drinking water.
However, we do detect it at the front end of the wastewater treatment plant. We do not detect it in the back end of the wastewater treatment plant. So basically, we're convinced that the wastewater process by itself is eliminating that organism. And that's very good data in and of itself, because it says something about the safety of the workers who are working in the wastewater field. But certainly it is not coming out of the tail end of the wastewater plants. We are not detecting it in our raw water, and we are certainly not detecting it in our finished water. So in terms of the transmission of the COVID by a water route, it's not there.
Staff at the SNWA Applied Research and Development Laboratories participate in a number of research projects every year to improve water quality testing and technologies. Their expertise in SNWA's state-of-the-art research and development facilities give them a unique opportunity to find answers to questions about the coronavirus and its impacts on the water and wastewater industry.
The Research and Development Division has been in existence for approximately 20 years. And what we try to do in that division is stay ahead of the curve in terms of new contaminants and new issues in the field. So we've been accepting money, external funding, to conduct this type of research for a long time. Long before COVID-19, we were looking at endocrine disruptors, pharmaceuticals, algal toxins. So this is just one of another series of events that comes along and will continue to come along in the waterworks field.
By measuring the presence of the coronavirus genetic markers in untreated wastewater, the Water Authority is collecting information it can use to monitor the presence of the virus in the community. Researchers believe this information may serve as an early warning system should the virus spike or reemerge. Scientists in the Netherlands pioneered the study of raw sewage to find viruses or pollutants, which is known as wastewater epidemiology. And they first proved the virus could be detected in raw sewage even before clinical testing confirmed the presence of the coronavirus in some areas. SNWA is partnering with the Water Research Foundation, universities, and other water agencies in coronavirus research. It's also working to share its research methods and findings with the water industry as well as lawmakers. Dan Garrity presented SNWA's findings and the role the water industry can play in the COVID-19 research to Congress in May.
So there were three main utilities who were invited to participate in the congressional briefing, and our role was to try to communicate why water utilities in particular were involved in this type of research, what we were finding, what are the implications for COVID-19, but more importantly, how can we use the information that we're generating now to provide critical information to decision makers for COVID-19, but also to respond more quickly in the future for any pandemic that might pop up 5 years down the road, 10 years down the road, and so forth.
While early detection of the coronavirus, or any virus that may occur in the future, may not cure the disease, it may help public health officials take the steps needed to keep the virus from spreading too quickly. And in these uncertain times, any progress in fighting the coronavirus is an important step in eradicating it.